Fat-soluble vitamins, Part 1, Vitamin A, Chapter 15, page number 285. Those who are joining late, please help them out with the page numbers. It's page number 285 in your nutrition science textbook, those who have the textbook. So types of vitamin. So what are vitamins? Vitamins are food factors which are organic in nature. Organic means what? They have carbon compound. Okay, they have carbon in their structure. So they are organic in nature. Minerals are inorganic. Okay. Minerals don't have a carbon structure. Vitamins have a carbon structure and must be supplied from outside through food to maintain your health and well-being. And vitamins, you cannot synthesize vitamin A within your body. Okay. So they must be supplied from outside food. Sometimes vitamin K and B are synthesized by the bacteria in your intestine, but again, it's bacteria, it's not part of your body. Okay. So vitamins can be categorized into two: fat soluble vitamins and water soluble vitamins. Fat soluble vitamins, vitamin A, D, E, K. Fat soluble vitamin is vitamin C, and all B complexes are water soluble. What do you mean by water soluble? It, it can completely dissolve in water and it can be removed from your body on a daily basis, okay, through urine and sweat. That is water soluble vitamins. So vitamin C and vitamin B, you require these on a daily basis. You have to consume vitamin C and vitamin B on a daily basis. Fat soluble vitamins like vitamin A, D, E, K, okay, they dissolve in fats, and they can, since your body can store fat, your body can store fat soluble vitamins as well. Okay, majority of them is found in your liver. Okay. So vitamin A, it was discovered in the year 1909. And again, vitamin A is a fat soluble vitamin. Okay. And vitamin A exists in different compositions. Okay. They have different forms. Retinol, it is only found in vitamin A in the form of retinol, is found only in animal sources. Okay. When we find vitamin A from plant-based sources, we call it as beta carotene. Okay. So retinol is what is a type of vitamin A that we get from animal sources. Okay, which are the animal sources? Any fatty fish, fish liver oils, meat, lamb, any liver of any animal or bird. Okay, dairy producers, breast milk. Okay, and vitamin A in the form of retinol is stored in your liver. Okay, for a long-term use. Provitamin A, that is beta carotene. You get vitamin A in the form of beta carotene from plants. Okay, red and orange fruits and vegetables like mango, papaya, red palm oil, carrots, dark green leafy vegetables. Okay, so they all are rich in provitamin A. Beta carotene is what gives your fruits this yellow, orange, red color. Okay, it's a pigment. And provitamin A has to be converted into retinol, and this conversion takes place in your intestine. Okay, only the converted form of beta carotene cannot be stored in your body. It has to be converted into retinol. Then only your body can process it. Okay, is it clear to all till here? So here you can see the conversion. Okay, different stages of vitamin A. So for 1 international unit of vitamin A, you need 0.3 microgram of retinol. Okay, but 1 microgram of beta carotene can be converted into 0.12 microgram of retinol, which means if your vitamin A is coming from plant-based sources, it has to be in large quantities. Okay, vitamin A has to be in large quantities from plant sources. Animal sources, if you have few grams of animal meat or liver, enough vitamin A you will get. Okay, but few grams of plant-based sources of beta carotene will not be sufficient to meet the requirement. So beta carotene is broken down. You can see here beta carotene is a long structure. Okay, it has to be broken down into half. Then you get retinol. Okay, this breakdown of beta carotene takes place in your intestine while the food is getting digested. So it forms into retinol. Retinol can be absorbed in your intestine. Okay. Retinol means what? It has an OH group. It's an alcohol, retinol. Okay. It has an OH group, hydroxyl group. Okay. Then it undergoes further oxidation. More oxygen, one more oxygen atom is added to retinol. What do you get? Retinol. It's an aldehyde. From alcohol, when it undergoes oxidation means what? Addition of oxygen. Okay. So it forms retinol. Okay. And once it reacts with ALDH, as that is, these are also some enzymes. Okay. Retinaldehyde, retinal or retinaldehyde, both are same. Okay. It can be converted into retinoic acid. Retinoic acid is the most potent form of vitamin A. Okay. This is the most active and the most potent form of vitamin A called retinoic acid. This is kind of retinoic acid is kind of a royalty of vitamin A. Okay, so this is how vitamin A will be converted at various stages. Okay, first it is beta carotene from plant-based sources. If it is an animal-based sources, this entire conversion is skipped. You directly get retinol from animal-based sources. Okay, if it is from a plant-based sources, you have to start from beta carotene. Retinol undergoes oxidation. It forms aldehyde, retinol. Retinol, in presence of ALDHs, some enzymes, it forms retinoic acid. Okay, it adds more oxygen, oxygenation takes place. Okay, more oxygen atoms are added, so it becomes retinoic acid. Functions, coming to the functions of vitamin A. This is the important part of this chapter. Functions. Okay, different forms of vitamin A, that is retinol, beta carotene, and then you have to come to the functions. First is vision. Vitamin A plays a very critical role in vision, especially in dim light. Okay, when you move from a bright room to a dim room, you need a few seconds to adjust your eyes. Okay, but if you are deficient in vitamin A, your body is deficient in vitamin A, your eyes will take longer, much longer time to adjust to the dim light. Okay, those people who can see clearly even in dim light, they are not deficient in vitamin A. So for the health of the retina, vitamin A is important. Especially the rod cells and the cone cells. Okay, rod and cone cells are the two different types of cells found in retina. Cone cells can identify color. Rod cells can identify light. Okay, rhodopsin cells, rod cells. So for the health of these rod cells, vitamin A is required. Okay. It is a light sensitive cell. Rod cell is a light sensitive cell for the health of these rod cells. And to make these rod cells in your retina, okay, vitamin A is required. So your eyes, a normal healthy adult's eye will have at least 0.01% of total vitamin A in the body. Some amount of vitamin A is stored in your retina as well, in your eyes. Okay, 0.01% of the total vitamin A stored in your body is found in your eyes. Growth. It helps in, vitamin A helps in the synthesis of certain glycoproteins, which are required for growth. Glycoproteins, proteins which has a glucose atom. Okay, proteins which has glucose compound to it, that is glycoprotein. So when animals, like a test was done in laboratory, when laboratory animals were deprived of vitamin A, they stopped growing in their body size, and their reserves of vitamin A from their liver were completely depleted. Okay. And an early symptom of vitamin A deficiency is you lose your appetite. Okay. Then your growth stops. There will be rapid weight loss. And then if the vitamin A deficiency continues, there could be an death as well. Okay. So growth is one factor that is affected by the deficiency of vitamin A. Even your bones may become weak. Okay. You may undergo some fractures as well. Failure of bone formation can happen because of vitamin A deficiency. Bone remodeling cannot happen properly, like after break or any fracture or something, or even after your regular bone formation cycle. Bone remodeling may not happen properly. This is how vitamin A affects growth. Then we have cell differentiation and gene expression. In your skincare, when we talk about cosmetology, vitamin A is very critical when it comes to anti-aging. Have you heard about retinols in skincare? Retinols, retinoic acid, retinoin, usually for acne and skincare related issues. Yes, retinol will help in the cell turnover. It helps in anti-aging. How it helps in anti-aging? It can quickly replace dead cells. Okay, quickly replace dead cells and new cells will come over quickly. This quick replacement is commonly seen in young adults, in children, teenagers, and young adults. But as you grow old, the way how your old cells are replaced by new cells, it slows down. Okay, the way how old cells are replaced by new cells, it slows down. But with vitamin A, even with topical application of vitamin A, the cell differentiation is fast. Rapidly, in the same pace how you were shedding old cells in your young age, the same pace, the same speed can be maintained here as well. Okay. So that is cell differentiation. It helps in anti-aging. It also helps in keeping the skin inside, even the cells inside your body, to keep it moist. Okay, to prevent dryness of the skin. Okay. Retinoic acid is required. Then in gene expression, to make your RNA, DNA, okay, retinoic acid is required. Retinoic acid is active form of vitamin A. Okay, that is also involved in cell development. Cell development, it includes gene activity as well. Formation of your DNA, RNA. Okay. So gene expression also to make RNA, DNA, retinoic acid form of vitamin A is required. Then we have the regulatory function. Same thing. To make sure that immature skin cells develop into mature skin cells. Immature any cells, okay, not just skin. Even your bone cells, if it is immature, it can mature into, it can turn into a mature cell. So a normal function of your body will be ongoing. Okay, that is the regulatory function. That is another function of vitamin A. Immunity. So vitamin A is required to maintain the normal health of your epithelial layer. Epithelial layer means your mucous membrane. Okay, you see into your nose, you have nostrils. Under the nostrils, you have the epithelial layer. Okay, inside of your throat, you have the epithelial layer. Inside of the small intestine, epithelial layer. What these epithelial layers do? They trap dust. They trap bacteria. You breathe in air, polluted air. Okay, epithelial layer, when it produces mucus, it is able to trap the dust, trap the bacteria. Any foreign invaders can be trapped in the epithelial layer. Okay. So to maintain the health of the epithelial layer, vitamin A is required. Okay. Just give me a moment. Okay. Am I audible now? So that's how vitamin A helps with immunity, the first line of defense. Your first line of defense are your epithelial layer, which produces mucus, which has villi, your nostrils, your skin. Okay. These all are your first line of defense. To keep these cells healthy, well differentiated, when the epithelial cells become old, it has to be replaced by new cells. Only then it can function properly for your immunity. Okay, so for this cell differentiation, cell turnover, a good amount of vitamin A is required. Okay, so that's how vitamin A helps with your immunity. Then in reproduction, vitamin A status of a pregnant mother and also lactating mother is very important. Okay, and if there was if the serum retinol level, serum vitamin A level in mothers, if it is less than 20 microgram per deciliter, it was seen that these mothers have a higher risk of giving preterm deliveries. Okay. So vitamin A is also involved in the synthesis of glycoproteins, proteins which has a glucose atom. Okay. Uh, and these glycoproteins, as we have studied earlier, it helps in the growth. Even for the growth of fetus, vitamin A is required in the form of glycoproteins that it can synthesize. So these all are the functions of vitamin A. Is it clear to all? Now coming to the absorption and transportation of vitamin A, chylomicron. Remember chylomicron for all fat soluble vitamins. Chylomicron is very important for the absorption of all fat soluble vitamins. Okay. Chylomicron, what do you mean by chylomicron? It has these two layers, outer layer and inner fat droplet. It's a fat, okay, it's a fat sphere, small fat globule. Inside there is a fat droplet, your triglycerides, and outer layer has phospholipids. Okay, and also some protein and some cholesterol channels are there. Okay, so chylomicron, since it has a fat interior, fat droplet, this fat droplet can carry the fat soluble vitamins inside the intestine. Okay, and because of the chylomicron, fat-soluble vitamins, vitamin A, D, E, K, can travel inside the intestine and out of the intestine into the blood circulation. Okay, this is because of chylomicron. So remember this structure, okay, for other chapters as well. So here you can see once the vitamin A in form of beta carotene or in form of retinol from animal protein, you will directly get retinols, retinyl esters or retinol. From plant-based sources, you will get beta carotene. Okay, beta carotene has to undergo conversion. Okay, retinol also has to undergo conversion. They both have to become retinal esters. Okay, and once it has become retinal ester, it can enter the chylomicron. Here CM means chylomicron. Okay, so once beta carotene has been broken down, it has converted itself into retinal ester. When retinol is also converted into retinal ester, okay, it has to undergo oxidation. Okay, so once it has undergone oxidation, it becomes retinal ester. Both of them can enter the chylomicron. Chylomicron will leave the intestine. It will get into the blood circulation. And through the blood circulation, it will go to the liver. And in the liver, retinal, since beta carotene and retinol both are in the form of retinal esters. Okay, in the liver cells, retinal esters will form back into retinol. And this retinol is stored in the liver. Okay, retinol, this is red blood, that binding protein, retinol binding protein. Okay, RBP4. Okay, it's a retinol binding protein. When this protein is bound to the retinol, only then retinol can again be circulated back into the blood. Okay, in its natural form, in the form of retinol, it cannot leave the liver. It requires a protein. Retinol, it requires a protein to travel in the blood circulation and reach wherever it is required. Okay, so once retinol gets bound by retinol binding protein 4, it will leave the liver and it will go to the brain, to the eyes, to other fat cells in your body, to your pancreas, muscles, liver, back to the liver. Okay, and where vitamin A's functions will be carried out. Okay, is it clear to all how it is absorbed and transported inside the human body? How vitamin A is absorbed and transported inside the human body? So again, you can see here, carotene or retinal esters will go into the chylomicron, or retinol can also go into the chylomicron through the blood circulation, and chylomicron will leave the intestine, enter the blood circulation, and then it will, through blood circulation, it will reach the liver. And here again, retinol esters will undergo esterification. Okay, it will form back into retinol. It will be stored in the liver. Okay, 90% of retinol will be stored in the liver. And this is sufficient for the next 6 months. Even if you do not have vitamin A rich food, the storage in the liver is sufficient for the next 6 months. Coming to carotenoids. Carotenoids are the form of vitamin A from plant-based sources. Carotenoids come in different form: alpha carotenoid, carotene, beta carotene, lycopene, lutein, zeaxanthin, beta cryptozanthin. These are the different names of different types of carotenoids. Beta carotenoid is the most common one and which is the best absorbed one in the human body. Okay. Beta carotene comes from carrots, leafy greens, sweet potato, cantaloupe. Cantaloupe is muskmelon. Okay. Pumpkin. These all are red, yellow, orange colored fruits and vegetables. Okay. They are antioxidants as well. Carotenoids are antioxidants. They have antioxidant property as well. Just be aware of these names: alpha carotene, beta carotene. If you know beta carotene, you will definitely know that there can be an alpha carotene as well. Lycopene, lutein, and zeaxanthin are important for retinal health. Lutein and zeaxanthin is important for your vision. Okay, it's found in leafy greens, squashes, Brussels sprouts, yellow corn. Okay, lutein and zeaxanthin is rich in these food items. Here, out of all these forms, beta carotene is the most important form, and it is the major dietary source of vitamin A also in humans. There are more than 600 carotenoids found in nature, but not all are healthy for human consumption. These are the few carotenoids which are good for human consumption. So carotenoid, beta carotene, you can see it is found in carrot, it is found in papaya. Okay. Beta carotene is found in carrot, it is found in papaya. Which beta carotene do you think will be absorbed better? The carrot one or the papaya one? Yeah, it is the papaya. Okay. Carrot, if it is cooked, beta carotene from the cooked or sauteed carrot can be absorbed better than raw carrots. Okay. Instead of eating raw carrots, if you slightly steam the carrots or slightly saute the carrots, the beta carotene in them can be absorbed better. Okay. Beta carotene in raw carrots is not absorbed that well. So there is a table 15.1 given in your textbook on page number 292. The absorption range of beta carotene in different food sources are given. Amaranth glaze, papaya, carrot, leaf protein, or crystalline beta carotene. Crystalline beta carotene is the synthesized one that you get in vitamin supplements. Okay. Coming to the benefits, health benefits of beta carotene. Cancer. Many studies has shown that high intake of food which is rich in beta carotene can reduce the risk of certain cancer, especially the female reproductive system cancers, GI system cancer, mouth, gum cancer, trachea, lung cancer, epithelial cell cancer. Okay. The risk of these cancers can be reduced. It does not cure the cancer. Only the risk of these cancers will be reduced. Because beta carotene is a really good antioxidant. Okay. Any food that is a good antioxidant definitely will reduce your risk of cancers. Then cardiovascular diseases. Beta carotene may also be an important nutritional weapon against cardiovascular diseases. Since it is rich in antioxidants, it can tackle the free radical attack that can happen to your arteries. Okay, which in which the arteries will become loose, it will become weak, and weak arteries are susceptible to plaque, to atherosclerosis. Okay, cataract, as I mentioned, beta carotene, or even other forms of carotenoids, especially lutein and zeaxanthin. Okay, good for your eye health, vision. Okay, even the opacity of your eye. Steamed carrot is good. Steamed carrot is better than raw carrot. People who have low serum keratin levels, they have higher risk of developing early cataracts. Then gastric inflammation, any form of inflammation, since carotenoids is an antioxidant, beta carotene is an antioxidant, any form of inflammation can be fought with beta carotene rich food. Coming to the RDA, recommended daily allowance of retinol, 1000 μg of retinol, which translates to 6000 microgram of beta carotene. If you are a non-vegetarian, 1000 microgram of retinol from animal-based source. If you are a vegetarian or you have majority of you, if you are having plant-based diet, 6000 microgram of beta carotene should be your daily intake. Okay, for adults. For children, infants, pregnant women, okay, and lactating women, the RDA changes. You can refer the table 15.3 on page number 295. Those who have the textbook 15.3, you can refer that. Whichever clients you get in future, based on their gender, based on their age group, you can recommend this. No need to by heart the RDA. No need to by heart the RDA. Tables are there to guide you. Okay. Nowadays, vitamin A is also fortified into the packaged milk as well to meet the RDA for majority of your population. Any packaged milk under state governments, under corporate society, if it is made, it has to be fortified with vitamin A and vitamin D. So vitamin A, based on the grams of food, the best sources of food. Okay. Dairy and egg products are a good source of vitamin A. In the form of retinol, vitamin A is highly bioavailable. Highly bioavailable means majority of retinol, which is present in dairy products and eggs, will be easily absorbed by your intestine. Okay. That is bioavailability. The food that you eat will have vitamins and minerals, but how much percent of these vitamins and minerals will be absorbed? How much percent of these vitamins and minerals will be absorbed in your intestine? That is what bioavailability is. Okay. All yellow and orange fruits are a good source of vitamin A, that is in the form of beta carotene. Mango, papaya, carrots, orange fruits. Okay. In Indian diet, majority of Indian diet is a highly plant-based diet. So eating a lot of leafy greens, okay, or green vegetables in general, along with papaya, which is found all through the season. Okay. Mangoes are seasonal. Sweet potato is also seasonal. Orange also. Every season you have some or the other vitamin A rich fruit. Okay. So you can go by seasonal inclination towards fruits as well to meet your beta carotene requirement. So natural sources of vitamin A, animal products, animal liver, okay, chicken liver, lamb liver, okay, any liver product, egg yolks, and dairy products are great sources of vitamin A in form of retinol. Plant sources, all red, yellow, orange, and leafy greens. Effects of processing and cooking will be affecting the vitamin A or beta carotene as well. Okay. Beta carotene is lost minimally when the vegetables are washed. You will not lose much beta carotene. But if the vegetables are cut, you cut it and you wash it, then also very few amount of beta carotene will be lost. Okay, not much because it is not water soluble. It is fat soluble. Okay. And 30 to 40% of beta carotene will be lost during cooking process. Steaming and pressure cooking will retain more beta carotene. Okay, like as I mentioned earlier, when you're using carrots, use the steamed version of carrots. Okay, even if you're pressure cooking carrots or any other sweet potato, if these things, if you're steaming and pressure cooking, you will not lose a lot of beta carotene. Okay. Cooking, if you're using green leafy vegetables, I have mentioned this earlier as well. If you cook green leafy vegetables or any green vegetables along with tomato, okay, it will help you to retain majority of the antioxidants. The lycopene, which is present in tomato, it can retain a lot of beta carotene from the greens. And always cook with your lid closed to retain the vitamin A in food as much as possible. Using oils also, like sauteing carrots a bit, okay, that sauteing pumpkins, okay, steaming the pumpkin and making a pumpkin soup out of it. These are all good practices to retain majority of your beta carotene. Pickles contain beta carotene, but we will not consider them a guaranteed source. Any form of pickles, okay. Only 10% of the actual beta carotene which was present when you have plucked or when you have brought the pickled vegetables, 10% of beta carotene can only be retained. So it is not a guaranteed or a dependable source, pickles. Okay. Exposure to sunlight can also destroy beta carotene since it is an antioxidant. And different kind of leaves, okay, different kind of leaves, and per 100 gram of these different kind of leaves, how much beta carotene they have, it is mentioned on table 15.5. Those who have the textbook, which leaf do you think is the best source of beta carotene from the table given? Just consuming 100 gram of these leaves, which leaves will give you the maximum benefit of beta carotene? Yes, it is drumstick. It is drumstick. And drumstick is known for what other minerals and vitamins apart from beta carotene? Drumstick leaves. Iron. Yes, iron and a type of vitamin B. Not B12. You will not get vitamin B12 from plant-based sources. It's folic acid, iron and folic acid. Drumstick leaves are a good source of iron and folic acid. They do have calcium as well, but we don't consider them the best source of calcium. Then you have the second best option is fenugreek leaves, methi leaves. Okay. Methi leaves are also a good source of beta carotene. For vegans, vegans can use leaf curd. Okay, leaf curd is not largely consumed in India as such. Okay, it's a leaf concentrate, so it is extracted from plant, uh, from edible plant leaves. Not all plant leaves are edible. Only from edible plant leaves you can make leaf curd. Okay, since preschool children and all, they will, and any children for that, not even children, even teenagers, they don't consume a lot of green leafy vegetables. So in such case, to meet the RDA, leaf curd can be given. It's a leaf concentrate. So a small portion of leaf curd can be added into your food. Okay, after preparing your dal or something, have a small chunk of leaf curd into the dal and serve it to the children. Okay, their vitamin A requirement, iron requirement, calcium requirement. Okay, these could be met. Not just vitamin A, but also iron, calcium, other mineral requirement, which that particular plant leaf is a great source of. Okay. So leaf curds are used by extracting the leaf juice. Okay. And then you slightly heat it. You extract the leaf juice, you grind the leaves properly, you extract all the juices from it, and slightly you warm it, and it will start to curdle, and you take that curdled part. Okay. Amaranth and spinach curds, leaf curds, they have the highest amount of beta carotene as compared to even fresh leaves. If you have palak as a leaf or amaranth leaves as a leaves in your sabzi, in your vegetable curry, these leaves will not give you the amount of beta carotene, iron, and calcium what leaf curd can give you. Leaf curds are considered much superior to your regular greens. The only thing is the fiber content, you will lose the fiber content of it. Okay, because you're just extracting the juice of it and you're curdling the juice. So you will definitely lose the fiber, the benefit of fiber, but fiber you can add from other vegetables as well. Okay. You can WhatsApp me. I'll share you a link of leaf curd, how it is made, how leaf curds are made. I'll share you a link. WhatsApp me. Just WhatsApp me leaf curd link. Those who have my number. I have mentioned my contact number in the chat box. Save my number and WhatsApp me leaf curd. I'll send you the link of how leaf curds are made. Okay. Coming to toxicity of vitamin A. Vitamin A toxicity is very rare. You will not suffer from vitamin A toxicity just by one day. It takes months and months to reach this level. Okay. Another name for vitamin A toxicity is hypervitaminosis A. Okay. So what are the signs and symptoms? You will have witness increased cerebral pressure. CSF fluid will increase. Okay. So that headache, heaviness in your head, you will feel. Generalized weakness, fatigue, headaches, dermatological issues like drying, peeling, itchy skin, cracked lips. Has anyone used Accutane, isotretinoin, or tretinoin that is directly on your face? Was anyone prescribed for this who had severe acne, or you were taking oral retinoic acid in the form of, did you suffer from dry skin, extremely dry skin, sensitive skin, peeling skin? Okay, because you are consuming high doses of vitamin A. Okay, when you are prescribed isotretinoin, Accutane, or if you are even applying tretinoin topical application, even though it is under prescription, you will witness purging.
Okay, first few weeks you will witness purging. A lot of acne is coming up on your skin surface because it, now the high amount of vitamin A has accelerated your skin turnover rate, the cells turnover rate. Okay, so vitamin A toxicity, you will start seeing the same drying, peeling, itchy, cracked lips kind of a situation, painful situation, okay, on a daily basis. Okay, so that means your vitamin A levels are going high. Upset stomach, nausea, vomiting, and even those who are prescribed on Accutane, uh, rate of depression is also quite high. It could be placebo as well because kids and teenagers or even young adults who suffer from acne, severe acne, face covered with acne, definitely they will undergo their body image crisis. Okay, and a lot of body image crisis is linked with depression. Okay, so it could be that depression or it could be Accutane accelerating the depression. We do not know yet, but depression, suicidal tendency is also seen with aggressive use of Accutanes. Okay, hair loss, nail infection, bone pain, joint pain, liver and spleen enlargement, because now the liver has to store high amount of vitamin A. So the liver will undergo inflammation, hepatomegaly, splenomegaly. Okay, this is the medical terminology of enlarged liver and spleen. Hepatomegaly, enlarged liver; splenomegaly, enlarged spleen. Okay, so it will usually never happen overnight. It will take you months and months to reach a level of hypervitaminosis A. How to control? You have to be well hydrated. Okay, why you have to drink a lot of water? Because majority of the vitamin A will be taken out of the body through kidneys. Okay, kidneys will help to take away excess amount of vitamin A from your body. Drink a lot of water, and if you are using a topical application of vitamin A, moisturized, always keep your skin moisturized. Avoid sun, please avoid sun, use sunscreen. Okay, avoid sun as much as possible. So that's about today's session.